is super simple. 3 simple steps. Number 1, control year-over-year spending increases so that you only increase annual spending by the rate of inflation and population growth, about 2.2% this past year. If they had done that, that would have shaved $1 billion off this year's budget deficit. The second step is stretching out the capital plan. We're racing to cram all of this capital spending into 3 years. If they had just stretched it out over 4 years, that would have shaved another $2 billion off this year's budget deficit. The third thing is ending wasteful spending. Things like the Carbon Capture and Storage Fund, $2 billion. The Alberta Venture Capital Fund, $100 million. And there's tens of millions in direct grants to corporations and other subsidies that is low-hanging fruit to be able to eliminate so we could get back into budget balance. Our party does not believe in corporate welfare. We do not believe that government should be picking winners and losers. Because when government tries to pick winners and losers, what always happens is taxpayers end up the ultimate losers. That would be the third area that we look at. And if we had done all of that, we would have been able to get back into budget balance this year without making massive cuts to frontline services. This is the thing that I think we've been told. We've been told that we either have to swing wildly between massive deficits or massive spending cuts. It's not the case. Just by restricting year-over-year spending increases, we can solve this problem in very short order and get back into the black and back into a savings plan. The last area I'll talk about before we get into the Q&A is healthcare. The budget from 2 years ago gave a year-over-year increase to healthcare of 18%, or $2 billion. And now for the next number of years, they're going to be increasing healthcare spending by about 6% per year, which may be 2 or 3 times what the inflation plus population growth level is. To me, this is an admission of failure of the new health super board structure. I think that Albertans aren't going to be fooled into thinking that all you have to do is dump more money into healthcare and we'll be able to solve the problem. If we want to fix the problem, we have to fix the system. The problem is that we do have a broken system and we have to fix it if we're going to get better results. In the Wildrose caucus, we believe that healthcare is going to be one of the big issues of the next election campaign. And we have put forward a plan, we released it on our website back in November, for how we would change the system to give Albertans the healthcare they want and need when they want and need it. This is the good news. The good news we can have is we can have a system that works. And we can have a system that works without spending all that much more than we're spending right now. What are we looking at? Well, there's a few things. There are countries in the world, in Europe, the European social democracies, where they have fixed and solved this problem. They've built their systems on the same values as ours, so they're principally publicly funded. They're universal, so no one goes without coverage. And they've managed to eliminate healthcare waiting lists. These are countries like Austria, Belgium, France, Germany, Luxembourg, Switzerland, and even Japan. Japan does it actually quite a bit less on a per capita basis than we do. But they've managed to find a way to give much, much better service at, in some cases, dramatically less on a per capita basis than we do here. The second thing I'd say is, what we've heard from Albertans is they want us to make changes that comply with the Canada Health Act. So if you look at our policy, all of the changes comply with the Canada Health Act, and I think this is wise. I think what this means principally is there's a few reforms that you can't look at. You can't have a parallel private insurance system operating alongside the public insurance system. You also can't have user fees and you can't have co-payments. You don't have to pull out your credit card or your checkbook to pay for medically necessary services. But there are lots and lots of things that we can still change that will allow our system to function better. And when you look at those 7 systems that work that I mentioned, there are 11 things that they have in common that make them work. 8 of those things can be adopted under the umbrella of the Canada Health Act through doing things like having health spending accounts to empower consumers to pay for the things that are not covered already by our insurance system, or also health savings accounts so that they can save for long-term care. By using Pt3 so that you can partner with private sector companies to build more affordable facilities. Through having smaller surgical centers operating outside the expensive hospital environment. When you specialize with a smaller surgical center, you can get more surgeries done. It's far more efficient. Through graduating enough nurses and doctors so that we can rebuild our primary care system by making sure everybody has a family doctor. Because guess what happens when you don't have a family doctor and you get sick? you go to an emergency room. That's part of the reason for the crisis that we have. Through refocusing our spending on building long-term care beds. Even Stephen Duckett, when he left after eating his cookie, he pointed out that we were over-investing in acute care beds and under-investing in long-term care beds. If we could get more of those patients in the right facilities, it'll free up beds for us to be able to use our hospitals more efficiently. And also activity-based funding. Now, there are a few other things, but let me just say a word about activity-based funding, because I think this is going to be key in being able to get a system that works. What we have right now in our system of block funding is we give a block of money to a healthcare provider, and it doesn't matter whether they serve 500 patients or 5,000 patients. They get the same amount of money. Under a system of activity-based funding, the funding follows the patient to the facility where they receive treatment. And when you empower local hospital administrators, an amazing thing happens. They find ways to innovate so that they can be more efficient, so they can attract more patients, serve more customers, and earn more revenues. So they'll open up operating rooms that have been mothballed, or they will find a way to open up hospital wings and use more beds that had been closed, or they'll find a way to use expensive hospital equipment more hours of the day than only a couple of hours. Those are the kinds of dynamic, innovative things that happen when you empower frontline workers and local hospital administrators to make these changes. And that's the kind of thing that a Wildrose government would do. So these are the kinds of things that you can expect to see from our party. We believe that this is what an effective opposition does, that it's not enough to just grouse about what the other guys are doing wrong. You also have to put forward your own positive ideas for change about what you would do to get it right. And I think it is important, especially with the events of the last month or so in mind, that we do keep in mind that there really is chaos right now all around the world. There are riots and protests and massacres and extremists that are threatening to destabilize what is already a very fragile world economic recovery. There are multiple Western European democracies that are on the brink of financial ruin. The Middle East has reached a crossroads of monumental importance, with one road leading to stable and healthy democracy, and another road leading to religious theocracy. Our North American neighbors are in equally dire straits. Mexico is teetering on the edge of becoming a failed state as a horrific cartel killing spree continues to take the lives of police and civilians. The United States is squarely on the path to financial collapse caused by unfathomable debt that generations of children not yet born are going to have to pay the price for. We live on a ship that is sailing right now through the eye of a hurricane, and how we steer ourselves from this moment on is going to determine the course of our future for decades to come, if not longer. We need to straighten our course and prepare for the entirely uncertain times ahead. We need to be better financial stewards so that we can not only survive, but thrive, no matter what it is the world economy throws at us. We need to be a beacon of hope and prosperity, a place of refuge from the storms ahead, where people from our nation and from around the world can come to and know that they can find work and prosperity and opportunity. We can be that place. I'm sure of it. We must be that place. But every now and then, maybe every 40 years or so, we need new people with open minds and new ideas who can look at the problems of the day and come up with better answers. Because if we stay on the track that we're currently on, we have to ask ourselves, as Albertans, what are we prepared to accept? Are we prepared to accept a government that tears up contracts and extinguishes ownership rights? Are we prepared to accept a government that thinks all you have to do is pray that natural gas prices recover in order to balance the books? Are we prepared to accept a government that's too afraid to stand up to the friends of Medicare and actually fix health care? Are we prepared to accept a government that stifles democratic choice? I hope you can see from a few of the things that I've mentioned here tonight that there is a difference between the Wildrose and the governing party. We have a fundamentally different approach to government. One that the PCs are never going to adopt, no matter who leads them. So, if you want a public health system that actually works, if you want landowner and leaseholder rights that can't be extinguished at the stroke of a cabinet minister's pen, if you want a balanced budget, and if you want a healthy democracy, then let's help us make it a reality. Many people say that Albertans want change. And that's good, because I'm here to tell you, friends, change is inevitable. The one thing that is consistent is that things will be different tomorrow. What Albertans really want is a government that represents the true feeling and the noblest purpose of Albertans, past, present, and future. One that represents what's best in all of us. MLAs in the legislature with the same honesty, creativity, hope, and sheer bloody determination that Albertans have themselves. Alberta is all about change. Looking back on the last 40 years, there's only two things that haven't changed. Our borders and our governing party. With everything else changing, maybe, just maybe, it's time for a change in the legislature. There are no better people anywhere for making a bold and decisive fresh start. And we think there will never be a better time than right now. Just thanks for having me here.